My name's William Ferguson. I'm a general practitioner from Auckland in New Zealand, and I've come back for my second go at the Fitgenes training. I first did it about 2 years ago, and in that time I've been gradually working it into my mainstream general practice, mainly for people with chronic long-term health conditions where we've been unable really to achieve the sort of things that these people have really wanted to with their health, whether it be problems with treatment-resistant obesity, treatment-resistant mental health issues, these sorts of things. But one of the things which has come to the fore recently has been the ability of the Fitgenes profile to help us get a better look at underlying cardiovascular risk factors. And I had a very interesting case recently with a 58-year-old man who had only modest cardiovascular risk factors. He had a little bit of hypertension, he had slightly elevated lipids, and he had a little bit of family history. And when we scored him using our conventional cardiovascular screening tools based on the Framingham data, I think his sort of 10-year risk was estimated at about 8%, something like that. And under normal circumstances, of course, there would have been no indication for further intervention. However, when I looked at his Fitgenes profile, he had a bunch of polymorphisms that indicated he was at serious risk of endothelial dysfunction. And when I looked at this bunch of polymorphisms, I ended up having to say to him, look, I think we've really got to take your cardiovascular risk much more seriously than what would appear on the surface. And I actually advised him to have a CT calcium score done to assess the extent of calcification in his coronary arteries as a de facto measure of the activity of the disease. So, for a 58-year-old, did he have sort of more or less disease than we would expect, for an average 58-year-old? So in the end, he actually agreed and went and had the test done, and we were really horrified to find that he was over the 99th percentile. In fact, the radiologists who did the CT calcium score said they'd actually never seen one that was that high. So he was entirely asymptomatic, and without the additional information of the Fitgenes, and obviously a response to that was to greatly intensify treatment of all of his cardiovascular risk factors and to have him regularly checked by a cardiologist. So I think that's just a good example of the insight that this package of genes gives to chronic disease process. And I think the interesting thing about it is that these genes are really being chosen from really deep in the engine room of all disease process. We know that inflammation, oxidative stress, detoxification pathways, all of these things are involved in a multitude of diseases. So yes, I'm finding coming back a second time and finding how much more has been learnt even in the 2 years since I was last here, and picking up some new insights on how important some of these genes are has been very, very exciting.